Does noise trauma always lead to tinnitus? Have you ever wondered if exposure to loud sounds guarantees that you will experience tinnitus? The answer is not as straightforward as you might think. Noise trauma refers to damage caused by loud sounds, and while it is a known risk factor for tinnitus, it does not always lead to it. Tinnitus is the perception of ringing, buzzing, or other noises in the ears or head without any external sound. First, let's talk about how noise trauma can affect hearing. Loud noises can harm the delicate hair cells in the cochlea, which is part of the inner ear. These hair cells are essential for hearing. Damage to them can lead to hearing loss and sometimes trigger tinnitus. However, how much damage occurs and how individuals respond can vary greatly. Next, it's important to note that not everyone who experiences noise trauma will develop tinnitus. Some people may experience temporary tinnitus that goes away after the noise exposure ends. Others might develop chronic tinnitus. Factors that influence whether tinnitus develops include the intensity and duration of the noise exposure, genetic factors, and overall ear health. Now, let's consider the underlying mechanisms. Tinnitus is thought to arise from abnormal neural activity in the auditory pathways after cochlear damage. While noise trauma can initiate these changes, other factors like stress, ear infections, and vestibular dysfunction can also play a role. Clinical studies have shown that noise-induced hearing loss is a common cause of tinnitus. However, the presence of tinnitus depends on complex interactions within the auditory system. Interestingly, some individuals with significant hearing loss from noise trauma do not report experiencing tinnitus. This suggests that noise trauma alone is not always enough to cause it. So, what can you do? Preventing noise trauma is crucial for reducing the risk of both hearing loss and tinnitus. Using hearing protection in loud environments is a smart choice. For those exposed to loud sounds, getting early intervention and regular hearing assessments can help manage potential damage. In summary, while noise trauma is a significant risk factor for tinnitus, it does not always lead to it. The development of tinnitus depends on various factors, including the severity of cochlear damage and individual susceptibility. Protecting your hearing from excessive noise is the best way to minimize the risk of both tinnitus and hearing loss. Always consult a healthcare professional if you have concerns about your hearing health.